Hello, everybody, and welcome to our latest Exercise in Place video where we're going to have a unique perspective for caregivers and exercise. I would like to thank Jerry and the team for letting me be the lead today. It always makes me feel good when I can be the one to introduce people. Now, coming from Johns Hopkins, people that we haven't seen for a while and we've really missed, Megan, Lauren, Ruben, and I think Finn is going to show up a little bit later. So we have a really good, exciting, different webinar today, and it's going to be very timely. And also we have a lot of slides and interaction. Let's get started. And I think I'll start off by introducing Megan.
Hi, yes. So my name's Megan. To my right is Ruben back there, and this is Lauren. So today we are going to focus in on the caregivers. However, this doesn't mean that it's just for caregivers, folks with myositis. This is a great way to learn how to have some conversations with your caregivers in terms of what you're needing and wanting from your loved ones. Before we get started, just a quick disclaimer. Yes, we are working at Johns Hopkins Medical Center, but all of the opinions and information presented are of our own and don't represent the institution. And the health information provided in this presentation is provided for general information and educational purposes only. It's not a substitute for professional health advice. Always consult your physician, your PTs, your OTs regarding your individual needs with regards to mobility and exercise. Always consult your physician before starting any new exercises. So what we're going to hopefully cover today is talking about how to be a healthy caregiver. We're going to talk about, as a caregiver, what are exercises you should be doing? We always talk about exercises for folks with myositis, but we can't forget about the caregiver themselves, especially if you're physically helping your loved one. We're going to talk about proper body mechanics and transferring and mobility techniques so that the caregiver themselves or the loved one can remain safe and healthy. And then we're going to talk about some of the emotional support you as a caregiver can provide your loved one with myositis, and some emotional exercises you can do as a caregiver to keep yourself nice and strong. The session today is going to kind of start lecture and demonstration. And by the time we get to more of the emotional stuff we talk about, it's going to open up to more of a collaborative discussion. So we hope you all enjoy, and I'm going to pass the mic over to Ruben.
Hello everyone, how are you guys? So we all know that caregiving is not an easy job. Typically, family caregivers are not formally trained to do the caregiving task, like us nurses and therapists. Usually, they have not undergone robust training to become a formal caregiver. Most of the time, these caregivers are unaware that they are caregivers themselves. They are simply being a good son, daughter, husband, or wife by taking care of their loved one who happens to be ill. Caregiving can be physically and emotionally demanding, and it can put a great deal of strain on your physical and mental health. So we want you to be a healthy caregiver. We want you to be strong and stay fit. As a caregiver, you may find yourself with so many responsibilities that you neglect taking good care of yourself. The best thing you can do for the person you are caring for is to stay physically and emotionally healthy. When your needs are taken care of, the person you care for will benefit too. I know that you juggle many roles and do as much as you can, but take the time every day for a physical activity that you enjoy. It can be as simple as spending 10 minutes walking around the neighborhood or working on your lawn. Any moderate level activities, even in small increments, can boost your energy level reduce stress, and helps you maintain a healthy weight and even your blood pressure and cholesterol level. We want you to eat well. A healthy diet will give you more energy and help prevent other health problems as well. If you have to eat on the run, which can certainly happen from time to time, try to choose nutritious snacks. We want you to keep up your emotional energy. Finding strength as a caregiver means more than staying strong physically, but also mentally and spiritually. Yes, it is important to take care of your body since you may need to bend, lift, or do other physical tasks, but personal strength is just as important. The stresses and strains of providing care to a loved one may take a considerable toll on your back, so we want you to take care of your back. It is important for caregiver to learn and apply proper body mechanics when lifting, transferring, or even helping reposition your loved ones. So later, in the later slides, we will be talking about what proper body mechanics is and how to apply them when you lift, when you move your loved ones. So next slide, please. Oh, there you go. So because of the demands, physical demands of caregiving, it is important to keep your body strong. It is important to have a regular strengthening program that works for you and that you enjoy. It should be simple and easy to do at home. It should target specific muscle groups such as your core muscle, your glutes, thigh muscles, the shoulder and upper arm muscles. And these are the muscles that you primarily use when you bend, lift, and transfer your loved ones. To be effective, the exercise program must be done regularly, at least twice a week, with a day or two of rest in between. As with any exercise program, start with what you can tolerate. Start with a lower intensity, high repetition type of exercise, then gradually build up from that. You may want to start using an elastic band. Then as you get stronger, you may transition to using a weight. And do not forget to stretch before you start exercising. Stretching reduces your risk of injury by increasing flexibility of your muscles and joints. As I mentioned, focus on the core muscle groups. These are the muscles that will help protect your back as you perform your caregiving tasks. If you have any history of soft tissue injury or any type of surgery and you're not sure of how to start an exercise program, please ask your physician to see if you're cleared to start with any exercise program, or have them refer you to a local physical therapist who can help you design an exercise program that is appropriate to your medical condition. Next slide, please. So once you're cleared by your physicians to exercise, you should aim for an exercise program that is well-rounded. It should address on improving your flexibility, your strength, and your cardiovascular endurance. So flexibility exercises are basically like stretching exercises like yoga, or targeted stretching exercises of your arms, your lower back, your leg muscles. Strengthening, as I said before, focuses on your core, on and targeted strengthening of your upper arm and leg muscles. And endurance training, these are aerobic exercises. These are exercises that increases your heart rate and your breathing, and improves your overall fitness. On the next slides, I will show you some sample exercises for each of these exercise category. Next slide, please. So these are samples of flexibility exercises, stretching exercises. Now, some of these may be too easy for you, and this does not cover all the stretching. These are just the sample things that I usually use in the clinic for my patient, especially with those patients with low back pain or patients with shoulder pain. So the first one, as you can see, the hip and knee flexion. Those are stretching for your glutes, for your butt muscles. Remember, when you stretch, when you pull your legs towards you, you need to be gentle, and you need to stop once you feel the stretch. There shouldn't be any pain, and hold it there for at least 15 seconds, at most 30 seconds, and then relax, let it go, and repeat it again. And each time you repeat it, you try to move it further from the first one, and there shouldn't be any pain. You should feel some stretch, And again, hold it for at least 15 seconds. If you can go to 30, then that's good. And repeat for like 3 to 5 times. And then you can do it on the other side. Similar thing you can do, similar principle of stretching you can do on the next one. The second one is for the hamstring muscle, where you lie down and pull your leg up and keep your knees straight. The third one down, it's called the child pros stretch. This is good for your lower back stretch. And the last one on the bottom is for your shoulder to stretch your rotator cuff muscles. And yep. And this one, the cat and dog stretch, this is a stretch that is good for your upper back. As you can see, you start with in all fours, hands and knees position. And the first thing you have to do is to sag your back towards the floor, and then try to tighten your stomach muscle by arching your back like a hunchback, tucking your tailbone as shown, and hold that position for like for this maybe like 15 seconds in the beginning. Some of you may not be able to do that, maybe 5 or 10, and then try to work up to like 15 seconds. And you may do like 5 repetitions of these. Next slide, please. The next one, these are more general exercises. As you can see on the first one, this is a standing stretch. Stretches the side of your body, the trunk. For those people who can have some balance issue, you can do it in sitting, shown on the second one down. The third one down is for your calf muscles to stretch. As you can see, the one that you're stretching there is the one that's behind, the leg that's behind. And then you lean forward. You can use a chair, or you can use the wall to lean on, and then you lean forward until you feel a stretch on your calf, and you hold it again for 15-30 seconds. And the last one down, this is for your pectoral muscles, the chest muscles. This is a good one where you basically you can put your hands like these, put it behind, and lean back and stretch. Take some deep breath and stretch. Hold it for 5-15 seconds, and then let go. You can do a few of those. Just to this is a good relaxation exercise as well. Next slide, please. Talking about the core strengthening. When we say core, some of my patients are asking me, so what do you mean by the core? Well, the core muscle groups are they're like the outer core and then the deep core. The outer core, as you can see, this is the rectus abdominis. This is the six-pack muscles, they say. These are the muscles, the outer core, the muscles that doesn't attaches to your back. They just attaches to your ribs. The one that you need to focus on when you're strengthening your core is your deep core, like the diaphragm, the transversus abdominis, the pelvic floor muscles, the multifidus, because those deep core muscles are the muscles that are attached to your spine, to the bone, which provides stability, when you move, when you lift, when you bend over. So those are the muscles that you need to strengthen, because they're the one that will stabilize your spine, when you do your caregiving task. Next slide, please. So this set of exercises, these are the basic core exercises. Some of you may not be able to go on your knees. You may have some knee pains. You may have to modify them. You may be able to do the first 3 exercises. The first one is the tilting the pelvic backwards. So you have to lay on your back with your knees bent up. And basically what you do to activate your core, the deep core, is to imagine like pulling your belly button down to your spine, and you will feel something here. You should feel, when you pull your belly button down to your spine, you should feel the we call it the TA muscle, the transversus abdominis muscle, activating. This is the muscle around the waist. You'll feel it's just you won't feel as much movement. It's very minute movement. But as long as you pull it in and tighten your butt, you'll be able to activate the deeper core muscles. And you hold it for like 5 seconds in the beginning, and then as you get better with this, you can hold it for longer time, like 10 seconds, and do a few, like 10 times in the beginning, and then move up to like 20 times. This next one is the bridge. Same thing, you need to incorporate the core activation, tighten your stomach muscles, and then do the bridge. At the same time, hold it for like a few seconds, and then down, and do a few repetitions. Usually I tell my patient, try like 10 reps, and then build up from that. And then you can incorporate like core activation, and then sliding your heel up, fall down and up, just like in the third picture. So with all these core strengthening exercises, the first thing you need to do is to learn how to activate the core, just like what I told in the beginning, by tightening up, putting your belly button down to your spine. That's the first step. And then do the movements that's shown on the pictures. The fourth pictures down, where you go on your hands and knees, and then you lift your arms up. So before you lift your arm up, try to activate your core, and then lift your arm, your right arm, put it down, and try the other side. Do a few of those. In the beginning, you may have difficulty combining activation of your core and moving your arm at the same time, and that's okay. Uh, you may want to practice more. You will get better. The more you do this, you will be able to do core activation and moving your arm at the same time as you get stronger. Now, the bird dog, that's a more advanced exercises. So in addition to moving your arm, you're also moving your leg up, which is more challenging. You may not be able to do this in the beginning, but as you get better, you can. And then for those people who are in a more advanced phase, you can do the plank. You can modify the plank. This is a beginner plank where you go on your knees and then go on your elbows and basically hold that position for like, some people, they can hold it only for 5 seconds. Some people can for 10, 20. Just do whatever you can and do it on a regular basis, because you'll be able to get better on this. And then once you're able to do a few of these, you'll be able to do a minute. And next one is the targeted strengthening for your arms, like the shoulder press, the triceps, the wall push-ups, bicep curls. Now you can start with some lower weights. Now my general rule for my patient is, if you want to start with some weights, maybe find a weight that you can do for like 20 repetitions and do that for a few weeks. And then find a weight that you can do for 15 reps, and then build up from that until you get to the 10 reps. And then you can use an elastic band, just like shown on the leg press within elastic bands. The static wall squats are good for your quads and for your hip extensors, and also the sit to stand, as shown in the pictures. Next slide, please. And endurance exercises. These are exercises that increases your heart rate and your breathing and improve your overall fitness. And you want to find endurance exercises that you enjoy doing. That's important, so you'll be more consistent in doing that. These are endurance exercises are activities such as walking, jogging, swimming, biking, or attending Zumba class, which you're going to do right now. And how long should you exercise? At least 30 minutes, at least twice a week. That is according to the recent U.S. Department of Health physical activity guidelines. In order to be effective, the person should exercise for at least 30 minutes, at least twice a week. And how hard should you exercise? It should be accumulated moderate level intensity exercises. What do you mean by moderate level exercises? You can, one way that I tell my patients, you can use a talk test to monitor how intense your exercise is. If you are doing a moderate level intensity exercises, you should be able to talk but not sing during the activity if it's moderately intense exercise. If you're doing a more vigorous level exercise, you will not be able to say more than a few words without pausing for a breath. So basically, it's just a general test. And for the next slide, there are many studies that shown that caregivers has an increased risk of suffering some back injuries from transferring, lifting, and repositioning their loved ones. And the most common cause of back injury are lifting heavy weights incorrectly, twisting your spine while lifting, and some jerky movements and poor posture or poor body mechanics over time. Next slide, please. So, so practice good body mechanics. Good body mechanics is basically positioning your body to maintain these natural spinal curves, as you can see in the picture. It's called the neutral spine when you bend, lift, and move your loved ones. So basically, the neutral spine position for the lower back is it's like a C curve. And as you can see, the proper way of lifting is you try to bend on your hips and knees and keep your back straight versus, bending on your back, which basically increases the stress on your spine, on your ligaments, and puts you on a more risk of injury. So you have to really bend on your hips and knees and keep your back straight. And this is the position where, why do we need to put you in a good body mechanics? Because it's the position where it's mostly efficient for you to do the task of lifting and bending. And it's easier to move or bend and lift when you put yourself in a neutral spine position. Hips, knees, bend there, but not on your back. Next slide, please. So, so this slide demonstrates the proper way of lifting. First thing you need to do is to approach. For example, you're lifting a box. You approach, you get as close as you can on the box. Spread your feet apart to maintain a wide base of support. And then bend on your hips and knees. Keep your back straight. And then pick up the box. Use your leg muscles, your strong leg muscles, and not your back to lift the box. And then bring the box closer to your center of gravity so that your back is not in constant stress of load. And avoid twisting and turning. You can pivot on your leg as you turn. Make sure when you're transferring or moving stuff, clear the way, plan the sequence of events. And the most important thing is, if you think that you cannot lift the load, ask for help versus, injuring yourself. Next slide, please. So for the next few slides, there will be pictures on how to assist patients, your loved ones, in positioning in bed, how to transfers, how to help them reposition in the wheelchair. The first part, the bed mobility part, some of the pictures are self-explanatory, but on the transfer part, we will demonstrate those. Next slide, please. So if your loved ones wants to get up higher in bed, instead of you pulling them up, you can ask them to help themselves. You can ask them to basically, bend their knees and they can push up using their leg muscles. If they can't do it, if they're laying on a blanket, you can help them with the sheets. As they push on their leg, you can help them to scoot up. Next slide, please. So if they're unable to turn in bed, one way of you have to encourage them to do it. You can ask them to bend one knee. Usually, if they're turning on the, let's say here, they're turning to their left side, you have to ask them to bend their right knee and use that right knee to push so that can help them turn to the opposite side. Now, if they need some more help, you can grab their shoulder and their hips. And then as they push on their leg, you can help them roll on their side. Next slide, please. And this slide shows the proper way of getting up in bed. So a lot of, I also see patients in the hospital side, inpatient side, and some of the common way that people get up is they forget to roll on their side. They just get up. And sometimes if you're in bed for a while and you're deconditioned, it's harder for your muscles, your abdominal muscles to pull you up. And the more efficient way of doing it is to encourage them to roll on their side and bring their feet and legs over the edge and use their arms to push up. Sometimes they cannot do it on their own, and you may want to help them on their arms as they push up. So you put your, yep, just like that, with help. But you encourage them to use their arms to push up to help. And also that's an exercise for them by itself. Next slide, please. So before you transfer a person, make sure you prepare the environment that you are transferring the patient to. Make sure that you clear the area of obstacle. Make sure there are any loose rags out of the way to prevent slipping. Remove any clutter. Get the equipment ready. Make sure all the equipment, the wheelchairs are locked. They're in good order. Beds and other equipment should be adjusted to proper height. Plan the movement. Think through the steps before you act and get help if you need it. If you're not able to support the patient by yourself, you could injure yourself and the person and your loved ones. Prepare the person, explain the steps to your loved ones, explain what you are doing and what you're going to do. Both of you should talk through the process. So if you have a gait belt, place it on the patient, and because this will help you get a good grip of your loved ones during transfer. The most important thing is ask for help if you think that you can't do it. You don't want to injure yourself. So these are 3 basic transfer techniques that we commonly use here in the hospital when we transfer patients. The stand pivot transfer technique, squat pivot, and slide board transfer. The stand pivot transfer, now I'm gonna explain it to you, with the myositis patient in mind. Stand pivot transfer, these are used for patients, like for IBM patients. These are patients who can still bear weight on their leg. They can support their weight through their legs. And they're weak to get up, and that's when you provide the assistance. But you have to ask them to use their arms if they can help to push up. And then once they're up, you ask them to take a step or to pivot on their good leg, and then turn and then go to the bed. Or in this picture, they're transferring the patient from the bed to the wheelchair. So normally we want to put the wheelchair on the stronger side. So let me demonstrate this part. So what Lauren is doing is trying to level the bed and the wheelchair. And this is the gate belt.
You don't want to try to be going uphill if you can avoid it, because that's going to make more work for you. You want to either go slightly downhill or make it even.
If you don't have the gate belt, but I encourage you to get one. First thing you ask the patient is to have them scoot forward, close to the edge. So let's say, make sure the brake is locked. So let's say, so in this case, I'm positioning, let's say the stronger leg is this side, the right leg. So I want the good leg, the stronger leg, closer to the bed, because it will be a lot easier to transfer, to do the pivot transfer towards on the good side. So once the patient has scooted to the edge, you ask them to slide their feet back, and then you encourage them to push up on the armrest, and you ask them to lean. You can do is you can hold them here, or if you have a gate belt, you put the gate belt on you. Okay. Big gate belt.
That was for Santa.
For Santa Claus.
And these are pretty easy to find, like online or wherever you can order them from. Okay, so I'm going to lean forward and help by pushing up.
Now, proper back mechanics, right? Back straight. 1, 2, 3, and up. Yep.
And then sometimes, the person might have to hold on if you need support.
And then you turn, pivot. And before they sit, reach back. And then I'm lowering down my hips and knees, keeping my back straight. And then if you want to transfer from, so this is the good leg. I'm gonna turn it. Put it on the, this is the good side, the strong side. Same thing, ask the patient to scoot. Bend under, bring your feet back. Lean forward, count of 3. Back straight. Ready, 1, 2, 3, and up. And turn, and reach back, and sit. Yep. So that's the stand pivot transfer. For the squat pivot transfer, these are patients who cannot bear weight on their leg. They cannot stand up. So they can, but they can bear weight a little bit of weight. So it's important that some wheelchairs, you can remove this, and you need to, because it's harder for you to clear the wheelchair without removing this. So,
and then also, you always want to position the chair and the surface so that there's really like no gap.
Yep.
A lot of people always want to put it kind of at a 45-degree angle, but then you have further that you're going to have to move the person, and you're going to have more of a gap. So you kind of want it just right catty corner along the surface.
yeah.
Yeah, we can position that a
Yeah,
little better.
there you go. That's better. So if the patient can scoot as close as they can to the authority, they usually encourage that. So you don't have to move them too far. And the same thing, they're on the edge of the bed, their knees are bent, and now they can only bend their knees a few inches off. So 1, 2, 3. Yep.
Ribbon.
You did all the work.
And then transferring back, you ask them to 1, 2. I just want you to show how I block the knees. So I'm blocking the knees.
Because if I'm not strong enough, my feet
Then
might
they'll slide.
be sliding out.
So I'm blocking it. 1, 2, 3, up. Yep. And the last one, the last basic transfer that we want to show you is the sliding board.
Can we do that one more
One more
time?
time? Sure. Okay. So we're transferring. I want you to transfer. Put the chair on the side of the good side, the stronger side.
And then I would hold
Yep.
on.
1, 2, 3, up. Yeah. 1, 2, 3. See, the problem is some people they end up twisting. You don't want to twist. So what I'm doing here is I'm pivoting on my leg. I don't want to twist. I'm gonna hurt my back.
So that's coming from the legs, yeah.
So instead of doing this, I put my leg out, so it's already there. I only have to make a few movements. Leg is out.
I don't know if you're gonna get to your feet.
1, 2, 3, up.
Very good. All right.
Okay. Last
Last
one
one.
is the.
And I think you can see the importance of caregivers keeping their strength by, like, just what you were saying, making sure to, do their own exercises to protect
Oh yeah. It's
that back
important
that you were
for
just
to-
showing.
That transfer alone, you really need to have good quad strength and back strength. At the same time, you need to exercise your core, or else you end up injuring yourself easily.
Right. This is wonderful. Thank you.
You know?
I've been strong, so.
I've been exercising every day, lifting my patients. So the last one is the sliding board transfer technique. So this is a sliding board. Again, you can get it online, right?
Yeah.
So these are for patients who cannot even lift their butt off the chair. So you have to put this here so that they can slide over to the bed. So the problem here, some patients, the difficult part of this transfer is you need to be able to put this underneath the butt. So one way of doing it is you ask them to lean to the side and put it under. Now the problem is, look. So here, look, it's not even. You don't want them to put their hands here, they'll pinch it during the transfer. So First thing I do is,
Well, maybe just some people can
They
do
can.
this by them. Some people can actually use this method to
yeah,
do it by
by
themselves.
themselves, right? That's
Or
it.
with less help, because
Yeah.
the bridge kind of boards,
That's
you know,
it.
the board kind of bridges the gap. But some people, even with the board, they will still need the caregiver assistance.
Yeah, so let's say Lauren can do this transfer on her own. What you need to do is the same thing. You ask the patient to scoot one step at a time. 1, 2, 3. Again, I'm using my knees wrap and to squeeze so that they're not going anywhere.
And it's doing it in kind of smaller increments
Smaller
versus
increments.
the one big pivot.
You don't want to do one big movement. So 1, 2, 3. 1, 2, and 3. And then sometimes you want them to scoot back. So what?
Yeah.
Yep.
Maybe this-
Up. What you
Okay, so
do?
say I'm kind of here, but I'm kind of at the edge of the chair. So if I'm leaning back like this, there's no way I can scoot back. So you have to help them
Yeah.
lean forward.
You can see this one. I can use it to push. 1, 2, 3.
And if they can, use their arms to help you.
Another way is.
Yeah.
In case you're sitting.
Yeah.
Let's say.
So I'm kind of at the edge here. So I'm leaning, say I got in the chair, I'm like this. So
Yep.
Ruben's gonna wanna lean me forward.
Yeah.
Yeah.
Well, sometimes this other one. So here, what I can do is to scoot one part at a time. Lean, and then.
So if you want to scoot like the right side back, have to lean to my left to take the weight off of that butt cheek, and then you can scoot it with less weight. And then lean the other way, scoot back that way.
Same thing forward. You can also do it forward, you know,
So
like this, and then, and back.
yeah.
And this, and then back.
And like putting a sheet on the chair can help, so you're not having to kind of pull on the person's leg. You can also, you know, just grab on their hip and help scoot forward, but it does help if you have something underneath to help slide.
Yeah.
Do you suggest doing that in bed as well, having a sheet for transfer purposes?
Yeah. Like what Ruben was talking about, pulling the
Right.
person up in the bed, having like
Yeah,
draw
like
sheet.
this. You have the draw sheet like this.
Yeah, if you wouldn't mind just quickly explaining that. I'm sure most people have seen that in the hospital where the nurses come in and they each one grabs the side of the sheet and they pull you up in bed.
So we can show you, like if you had two people.
Most people probably only have one. If they're lucky.
Yeah.
Yeah.
You want it to scoot
To raise it up.
Oh, raise
Yeah.
That was good body mechanics, guys.
Megan calling her out. Gotta have a little fun, right?
That's what I'm here for.
Raise up?
Yeah.
Oh, okay. Here you go. So again, if you don't want it to be too low, so what I do is I usually raise it up so I don't have to bend over.
If your bed is low, then there's nothing you can really do, but you want it to be at a good height for your back so you're not having to bend too far.
Patients
And there are bed risers out there available.
legs are wider apart.
Back straight. You're going to grab the sheet.
Okay, 1, 2, 3, and up.
And it's not only just pulling with your arms, it's more of like I'm starting with my weight on my right foot,
Yeah.
and then you shift your weight onto the foot that's closer to the top of the bed.
You can ask your loved ones to bend their knees so they can help to push. So 1, 2, 3, and push.
If you're only one person, you can either go on the side and do a little bit on this
Yeah.
side, then go around. Or if you can go behind the bed,
Yeah, behind the bed.
squat down,
Like
and
this.
you're really gonna wanna kind of lean back, squat down into it, and pull it back.
So basically my leg is like
Perfect. So all we're doing is we're just adding an extra sheet on top of, like, say, the fitted sheet
yeah.
for this purpose. Perfect. Thank you.
About all the repositioning and transfers. Is there any questions about any of the strategies to physically support your loved one? So those are just some of the references from Ruben's section. Thanks, Ruben.
No problem.
Didn't know how strong you were.
No, I felt light as a feather.
Yay, Ruben.
All right. So, surprise, Megan and Lauren are talking about the feelings. That's kind of our thing from OT. Not that OT is the only people who talk to folks about the emotional support, but what we want to talk to you about today is emotionally supporting your loved one. So, yes, when we talk about caregivers, we want you taking care of yourself, and we're going to talk about that. But you also might be put into positions where you feel like you want to emotionally support your loved one with myositis, and you're trying to figure out how to do that. So that's what we're going to talk about. So I just wanted to start with some quotes just to start with acknowledging caregivers. I thought Ruben did a beautiful job on his first slide. Well done, Ruben. On the first slide, just talking about, because sometimes you don't even realize you're a caregiver because you're just a person's husband or son or daughter or sister or brother. You don't view yourself as a caregiver. But anytime we are taking care of another person, that's the role we have. And it can be tough. And there can be a lot of stress with it. And there can be feelings of guilt and fear and anxiety. So I like this quote. And it's just to let you know that you're awesome. You really are. You're doing a great job, whoever you are, because you're here and you're watching. So you clearly care about your loved one. The next slide is a quote from one of the people I find really, and all these quotes I just, Google imaged, but this is a quote from a guy that I find really inspiring. His name's Eckhart Tolle. He's who I learned a lot about mindfulness and presence and the power of now. And again, this kind of speaks to just that you're awesome and acknowledging that you have good in you. And it's the foundation for all abundance. So if you're ever feeling lost or not good enough or that you don't know what to say or do, just remember this, that deep down, you're good. You're a good person. And whatever else needs to come, it will come naturally because you've got good in you. And next quote. It's okay to not be okay. Lauren and I think have to tell ourselves this all the time. We're not perfect. We're going to make mistakes. And it's okay to be flustered. It's okay to be angry and sad and stressed. And it's okay not to have the answers. It's okay. And give yourself a little break. You don't have to know it all. And you don't have to be the perfect caregiver.
Right, because like Ruben said, most caregivers are not going to have any professional training. So, how can you be expected to know everything or know how to do everything correctly if no one ever taught you? You just sort of started taking on this role to help your loved one.
Yeah. This is kind of similar to like something my fiance told me one time. I just like this quote. It's okay to have a meltdown. Just don't unpack and live here. Like I said, it's okay to not be okay. But it's not okay to just live there. You don't deserve to live in a sad state of being the rest of your life or an anxious state of being. And this goes to anyone with or without a diagnosis. And so just knowing that, okay, you can acknowledge that you may be having a hard time, but it doesn't mean you have to accept it for the remainder of your life. It means there's something you can do. There's a next step. And I think the next quote I thought was
Okay, well, this wasn't what I was thinking of, but I really liked it because it was from the Dalai Lama. In that those tough times when you're feeling like, you might be sad or stressed or angry, remember that the wisdom and inner strength that you're going to develop when you overcome or you move forward from this is going to be incredibly powerful. And I think the next quote is what I think of the myositis support and understanding, which is community. And the fact that you're watching this, the fact that you took the time to reach out and be a part of this wonderful community shows that you don't have to go through this alone. There are people in this community that can relate. There are people in this community that can offer you advice, and the people in the community who can empathize on a 100% level. Lauren and I can empathize from a clinical standpoint, but a caregiver to caregiver or patient to patient or human to human level, this is the kind of platform that is a great way to lift each other up. So kind of throughout what we're talking about in this next section, please be active in Q&A or chat just with comments, because that is kind of the power of overcoming some of the things you might be dealing with. So we're going to talk about some strategies to help when you find that your loved one is in certain emotional states. And again, this doesn't have to be just caregiver to patient. This can be patient to caregiver. And when I say patient, I mean your loved one who has a diagnosis of myositis.
Sure. Right, because we know with myositis, everyone's going to have tough days, both physically and mentally, emotionally. We can't expect you to be positive all the time, because we know you're going through a lot. You're dealing with, not being able to do things that you were once able to do, or feeling like loss of strength, loss of function. So like Megan said, it's okay, of course, to have those days, have those feelings, and, we want to offer your caregiver suggestions of how to support you through that. Or, sometimes if your caregiver is having a tough day, the person with myositis can also offer support in that way. So even though the person with myositis may be, requiring some physical assistance, they can also be a caregiver in a way of, providing emotional support to their loved one. So if the person, with myositis is feeling down, feeling sad, or feeling kind of pessimistic, like hopeless, or that things are not going to be able to get better, you don't want to just say, oh, it's going to be all right. You'll be fine. You'll be okay. Just cheer up. Can you just be happy? Because that's kind of minimizing those feelings of sadness or pessimism that are fully valid. And you don't want to just kind of dismiss them and say, oh, if it was that easy to just improve your mood, then of course everyone would do it.
Have you ever just cheered up?
Yeah, exactly.
Just cheer up.
Oh, okay. So just, actually acknowledging the sad feeling is really important, and not always necessarily trying to fix it. So sometimes it really just helps to let the person vent and just listen to their problems and their concerns, and don't always trying to be saying, well, what about this? What if we do this? There's definitely a time and a place for problem solving and finding solutions, but sometimes you got to just let it out and, kind of get it out of your system.
I think that's so important, Lauren, that we don't go into this role with emotional support with the idea that we're going to fix it. Right.
Right. Because this is, a kind of a lifelong thing. It's going to be something that the caregiver and the family and the person, have to learn how to cope with and deal with. It's not going to be something that's just ever an easy fix.
Absolutely.
So good suggestions of just, instead of, trying to just say something to make it better, try and do something together, listen to some music, go out for a walk or a change of scenery, have a meal or a snack, do something that you enjoy, or, watching a inspirational movie or reading a book, something that is just going to make you feel better in that tough time.
Yeah. The thing about sadness or even stress, it's an actual chemical release in your brain. It's not just a thought or a feeling. There's actually a chemical exchange in the brain. And, sometimes you just can't talk away those chemicals. Those chemicals are still flowing. So using a distraction technique can be really powerful to change the focus of what the brain is focusing on and start to allow some of those chemicals to subside. Sometimes, you have to be careful as a caregiver, because if you I know we say, acknowledgement means well is good and listening is very good. However, perseverating is not good. Perseverating is when someone will focus on something, and we're talking extended time, like hours,
Like
days.
getting stuck there.
Yeah. And at that time, you may have to be a little more blunt, because the chemicals are running so strongly, you might not be able to change them. And we've all been there. I mean, come on. We've all had those days where we kind of ruminate on something and it's hard to get past it. And you have to, when a really good friend, for example, would come to me and be like, Megan, this is the 15th time you've told me this stressful story. I need you to stop. And you kind of have to be like that wake up call. Now, they shouldn't tell them that to me the first couple of times I talk about it. That could be jarring. But so it's a balance. You want to listen. You don't want to go in ready to save the day. But if it starts to get out of hand, you want to be honest and say, listen, I'm not saying this to be mean. I'm saying this because I'm genuinely worried that your body is remaining in this heightened state of anxiety or stress or sadness.
And I don't know if you talk about this or not, but if there's ever a need for the caregiver or the patient to seek out mental health professionals, please do. I know, like she talks about getting stuck there. Some people may require an antidepressant. I mean, there's these chemicals, like Megan said. So just keep that in mind, that there's nothing wrong with that. I'm on antidepressants. I have been for, 19, 20 years now. There's nothing wrong with it.
Yeah, we definitely recommend, seeking out mental health treatment if and when you need to. It's definitely, like you said, nothing wrong with it. It's very helpful to a lot of people, and very important tool that you can use to help with your mood and stress. Okay, we can go to the next slide. So how to help your loved one when you're kind of dealing with a feeling of apathy, kind of just loss of interest in things, not really caring, saying, oh, I don't really care what we do. I don't really care. It doesn't matter. So again, we don't want to say, just cheer up, just get over it. And you don't necessarily want to say, just push through it. Let's just do this. Because if it was that easy to just push through it, then you wouldn't be in this kind of state of apathy. So kind of with the sadness, you really want to listen and let the person express what they're feeling. And same thing of trying those distracting techniques, like doing something to kind of break out of the cycle of not being interested. Try to really find a hobby or an activity that you enjoy that you can do together. Support groups like online, like Myositis Support and Understanding, or anything in person, either with just family or other people with myositis is really helpful. And then sometimes just taking those really small wins, if it's something that happened during the day that, it's just a small positive, and really celebrating that and focusing on it. And even if it doesn't have to be a big thing, but, every small victory is important and it counts. And we have to look at what we can to be positive. And then we're also going to talk about, on a later slide, some gratitude exercises. So we'll kind of go into that a little bit more.
And just know with apathy is a symptom of depression. So if it sticks around and you find yourself not even finding interest in things that you used to find interest in, like, if I love to golf and suddenly I go golfing and I find no pleasure in it, that's something a little more serious. That's called anhedonia, and it is a symptom of depression. That's something you don't want to ignore or try to fight through or figure it out on your own. That's definitely something you want to talk to your doctor about, because you can get either medicinal support or therapeutic support. You don't have to do all that on your own, and it can really help.
Right, especially because we're suggesting that you do these things that you enjoy as a strategy to help with coping, but if you're not even able to get pleasure from them or get enjoyment, then it's not going to be an effective strategy to do this kind of activity or hobby. So if the person, with myositis as caregiver, someone's just feeling angry, you're just having a day where you're just, angry at what's happening to you and what your situation is and things that you can't control or can't change. Of Of course, you never want to tell someone who's angry, just chill out, just relax, just calm down. That always escalates. If you're feeling not calm and someone tells you to calm down, it just makes people become sensitive, and it just, tends to make it worse. And you might redirect that anger that you're feeling onto the person who's trying to tell you to relax, and then you're just getting into a fight. So again, listening, so important. Same thing, just kind of letting the person vent their anger. Maybe they just need to be alone. Maybe they don't want someone just there listening or making suggestions for them. Maybe they just need some time to cool off and go do something by themselves. Also, don't argue. Don't try to kind of counter the person's points. They might just be in that state where they just need to let it out and just vent. And they're not going to be in like a rational place where you could have a conversation about it. It would just more turn into an argument. And again, distracting activities are good, especially in an angry state or anxiety state. You want to kind of do an activity that's going to be more calming versus something that's kind of going to keep making you more anxious or angry. So like calming music or some movement. A lot of times physical activity can really help calm the nervous system. Thank you.
A great time if you have pets to use them for some emotional support. Why don't we play puppies for a while?
Emotional support animals for sure.
Yeah, we talk about this in the office. We work with folks who are really sick in the hospital, and they can often be pretty angry. And the important part is when someone's, sending anger your way, you don't have to accept it. If you're the caregiver or you're the one with myositis and the person you're interacting with is getting very angry, you can have the choice to allow that anger in, or to say, you know what, that anger doesn't belong to me. That anger belongs to you. And I'm going to maybe take some space to make sure that that person can handle and deal with their anger on their own. I'm choosing not to accept that anger. I'm going to choose to accept some space. That's one thing that I know I, as a therapist, like to remember when people are getting angry, when I tell them they have to get up.
Yeah, I can attest to that. I've been that, not so much angry, but like I don't want to do it. I feel so terrible. I feel hopeless. Why are you making me do this? I should get that all day long. Do you want to move to the next one?
Sure, yeah.
Okay, so kind of a little bit similar to angry, but in the reaction, but just feeling anxious, stressed, fearful, like we said, things that are out of your control or things you don't know what's going to happen. You don't know how your weakness is going to progress. You don't know how you're going to feel. You don't know what you're going to be able to do. So this all things that can cause a lot of anxiety because there's a lot of uncertainty and lack of control. So you don't want to tell a person who's anxious to relax or chill out. You want to help them to be able to relax, but saying those words is not a helpful strategy.
It makes it worse.
So again, the distracting techniques can be really helpful, and focusing on the ones that are more calming for the nervous system. You don't want to, do something that's where they would be giving you more energy or giving you more stimulation. You kind of want to keep it, more calming, more soothing, like calm music. Going outside for a walk. Just like we said, with the watching a movie or a song or something that's inspirational to you or just kind of gives you a positive feeling. Sometimes it can just be something as little as that, as this is every time you watch this movie, you feel a little bit hopeful, and you can always, it's a response in your brain that's going to be triggered by that. It's just trying to elicit, like Megan said, that chemical response sometimes is what you need to help break out of the cycle.
Okay, so my favorite picture I found on Google is a Halloween costume you can get for kids. But Ruben talked about all the great physical exercises you can do as a caregiver. And exercises that he was talking about can help you look like this. But the exercises we're going to talk about will make you look a little more like the next slide, which is a little more balanced. And these are emotional exercises. Remember, our brain is a muscle. And our emotional intelligence is a process that happens in the brain, and so we can do exercises to strengthen that. which will help as a caregiver to become mentally strong, and as someone with myositis to do the same thing to help you with any kind of emotions you might be dealing with. There's lots of different exercises we could go over, and we didn't want to, bog you down with all the self-care exercises, but we're going to talk about a few that we really believe in. The first one is gratitude. There's lots of literature and research on gratitude. I find it really fascinating, and I wish I was better at doing it myself. But when you are in a state of gratitude, when you are fully in a state of gratitude, it is physically impossible in your brain to be angry or stressed. But you have to commit. You have to be in a full state of gratitude. Like, those two parts of the brain can't be activated at the same time. Now, the issue with gratitude, they took a class in it once, and they said telling someone to write down something they're grateful for once a day is probably the worst thing you could do for them, because then it turns into a chore. It turns into this thing they feel guilty if they don't do, and it makes them work really hard to find something, and then it turns into like a stressful situation. So I wrote a bunch of different prompts on this slide. These are different prompts we give our folks with myositis when we see them, as different ways that you can incorporate gratitude in your day. For example, one of them I like says, like, thank you for, or write something, like write about a bad thing that didn't happen today. Like, I didn't get into a car accident today. Like,
didn't fall today. Like, that can be a small win.
I know, the ice recently, like, legitimately, we had really bad ice here. 5 things you're looking forward to the next month. I mean, it could be one thing, but write about a person you're thankful for. You don't have to just write down something today that you're grateful for. It can be something around the idea of gratitude. And there's a really a nice study that followed people that did a journal such like this. And, after 3 months, their overall mood and emotional intelligence scores skyrocketed. So it's really, really powerful and super simple. But, like humans, like I'm a human, I don't do it regularly enough. This is a good reminder that I should be doing this. The next mental strength exercise, mindfulness. I'm a huge, supporter of mindfulness. It's changed my life. And mindfulness could be its own session, so I'm not going to go deep into it. I just wanted to give you some resources that I found helpful when I was getting into mindfulness. If you have smartphones, the Calm app and the Headspace app are my 2 favorites, but if you look on Google Play, the mindfulness app is the highest rated right now, so I included that. I don't know anything about it, but I meditate with the Calm app every morning. The meditations can range from 2 minutes to 2 hours. You can decide how much time you want to give to it in the day. Really powerful stuff. If you're really into mindfulness, the book Full Catastrophe Living by Jon Kabat-Zinn was the book I used in my certification class, and it helped me understand what mindfulness was all about. And then I just put TED Talks on YouTube because I was going to put a few links on here. But if you put into, if you're searching for TED Talks and you write mindfulness, or you search YouTube and mindfulness, you're going to come up with so many videos, and you can find the ones that work best for you. And then the mental strength exercise that's my personal favorite is read or watch something inspirational. It can really inspire you, and it can have this amazing chemical reaction in your brain. There's a research study that showed that people who were looking at pictures of weddings versus people who are looking at pictures of funerals, the different areas of the brain that were lighting up in the MRI. Those who are looking at something inspirational or motivating, like a wedding, the areas of pleasure were lighting up, and those obviously who are looking at funerals, they left feeling pretty negative. So I just wrote these aren't like science proven. These are literally Megan's list of books and movies that I read and watch when I need a pick me up. These are things I read and watch every few years. My favorite is actually this book called Spaceman by Mike Massimino. He was a guy who absolutely everything that he had going on in life, he should not have been an astronaut, and he just decided he wanted to be an astronaut. and he did it. And it was his journey, and he's funny, and he's what he overcame was incredible. Highly recommend it. And then those are some of my movies. I didn't know if anyone wanted to share their books or movies that when they watch, they're like, oh God, that was a good, like, Remember the Titans will always make me laugh and cry and just want to win. So, Ruben, do you have a movie or a book?
Well, I don't know if they're interested with the books. What I'm a fan of Steve Jobs.
Oh,
Technology.
yeah.
So I always how Steve Jobs, the biography of Steve Jobs, I always get inspired
Yeah.
on how he built Apple.
Yeah.
And every time I feel down and it's like, oh, I need to listen to the audiobooks about Steve Jobs, and it gives me an inspiration on how he created Apple.
Yeah.
It's like focuses me and things like that. But it's just me.
Yeah.
I like technology.
Yeah.
It's also you have to find
an
an interest and
Yeah. Do you have one, Lauren?
It's not really inspirational, but if I'm ever feeling stressed, I like to watch The Office because it's just funny, and it's like I've seen it so many times that it's just familiar to me, so it's like comforting. So it can even be something like that if it's not directly inspirational, but just something that creates a positive feeling for you, helps you relax, feel better. Just take your mind off things.
Yeah. Disney Plus has helped me a lot.
Yeah.
All right. I think we have like 2 more slides. Nope. This is just a bunch of strategies. So we talked about, use therapy and counseling if you feel like you need it. I like including laughter. I joke around a lot, and that's how I keep sane. Working in healthcare, especially in the hospital during a pandemic, you either laugh or you cry. So sometimes you just got to see the humor in things. If you want to stay mentally strong, also try to incorporate some mentally challenging tasks. I know when my dad retired, he was really nervous that because he wasn't working, he wouldn't keep sharp. So every day he does a couple of Sudokus, a couple of crosswords, and he goes for a walk. So that's what he does. John O'Leary. Nice. And then never underestimate the importance of fun. Like if I could have a career, it would just be in fun. And it's funny because my brother's a recreational therapist, and so that's what he does do for work. So on the next slide are it's suggestions for activities you and your loved ones can do. And the whole point of this slide is I want you guys to really think of activities that you can do together, that you can bond over, and it's unique, it's out of your routine. Especially in the pandemic, a lot of people have kind of gotten used to just a regular routine of maybe self-care, exercise, housework, and then go to bed. Try to do something out of the ordinary that can just shake things up. It's really good for releasing things like endorphins in the brain. These are things that I've done recently, which is I've done trivia, watched a really good movie, watched some virtual concerts, made a homemade home decor piece. We tried a new board game. Okay, we haven't done this, but this is a thing we're trying to do, is write a story of how our relationship began. Also didn't do this, but I thought this would be really fun. Karaoke. What do you think, Ruben? Karaoke?
Good, yeah.
Okay. Stargazing, there's nothing more simple, but also more beautiful and calming. So you see where I'm going with this, right? Like, we just have to have fun. We need to go back to when we were a little spontaneous, when we were younger. And just because maybe with myositis you can't get up and go hiking or swimming doesn't mean you can't do something spontaneous and fun. Like I said, as simple as stargazing can be, it can be fun. You can try to find different, what are those called? Constellations. And so on. So.
Or it's a perfect time to use visualization while you're out there, and just use your creativity and think about other planets that are up there and the potential for just neat little creative things that can really. I've learned to use visualization for pain, and it's really neat where your mind will take you sometimes. Okay, unfortunately, yeah, we're having some trouble with audio, but this was the end of the presentation. The girls just told me, or Ruben just told me. Please feel free to email either Lynn or myself, and we will be sure to send that over to Megan, Lauren, Ruben, and Finn. And when they have the time, they will get back with us. They are working, as you all know, in a pandemic, so things have been quite stressful and busy for them. And we would like to thank them for essentially putting their lives on the line to help other people during this. So thank you so much for that. And with that, thanks again, guys, from Johns Hopkins. We really appreciate you focusing on the caregiver today and the support that they deserve and need. So many people come to this with no training. So we hope that this video will help with that for those that are in need of some of this excellent information. Lynn, did you have anything?
Thank you, Jerry. No, just to remind people that we're here supporting Rare Disease Week, Rare Disease Month, Rare Disease Day, and anything you can do to raise awareness of myositis through a profile picture or compete in our, I guess we're having a, you can't see the forest for the trees, anything you can do to with outreach to other people, family and friends, to help them understand what we with rare disease go through. That would be great.
Have a great night. Thank you again for joining MSU, Ruben, Megan, Lynn, Lynn. Unfortunately, Finn didn't make it. We'll get him next time. So
thank you all for coming.
Yes, have a wonderful evening. Good night.
Bye-bye.